Hello people, in this video we want to look at this topic Reinke's edema. So edema, you know the word, right? What it means? Basically, the fluid accumulation. So where does this happen? In the Reinke's space, okay? So in the Reinke's space it happens. Is this the correct pronunciation? Reinke? So this Reinke's space has edema. So this is what it is. So this happens in smokers mostly. So now let's look at it. First let's understand the space of Reinke. So this is your neck, let us say. So the air is going up and down here, right? This color is bad for you. So look at this in a better color. So the air is going up and down, right? In the trachea. So who is protecting this? It is the vocal cords, okay? There are two things like this that close and open, right? For your speech also. So these are the vocal cords. Now what they have done, they have taken a cross section of these vocal cords. Okay, now let us look at the details of the cross section. So where is Reinke's space? Here. Superficial lamina propria Reinke's space. Where is it exactly, guys? This one. Okay, so this is Reinke's space. So here if there is edema, it becomes Reinke's edema. So this is the vocal cord. They have taken the cross section of it, right? And this is the air going up and down, right? So when they have taken cross section of this, there is Reinke's space which they have marked here. Let us look at another diagram here. So they are showing that this is so there will be one more here like this, but here is the epithelium. Then there is Reinke's space here. Reinke, okay, look at the spelling here, R-E-I-N, Rein, K-E, okay, we'll always go with the spelling, so Reinke, Reinke space. So here there is going to be fluid accumulation, that will be Reinke's edema, okay. It is affected by edema. It causes polypoid degeneration of vocal cords. It causes polypoid degeneration of vocal cords. So what and all is this Reinke space affected by? Edema. And that will lead to polypoid degeneration of vocal cords. So in the larynx, we are in the topic larynx. So there are so many spaces, but we are concerned with the Reinke's space. So guys, how is it going? Look at the structure of the vocal cords. Stratified squamous epithelium, lamina propria. In that lamina propria, the superficial layer is called Reinke's space, right? After that, you anyway saw some deep layers, leave that. So the superficial one is the Reinke's space. So what and all you have? You have the epithelium, right? So what and all you have, guys, let's draw again and see. Epithelium. Under that you have superficial lamina propria, under that intermediate lamina propria, and then deep lamina propria, after that some muscle, right? So the superficial lamina propria, superficial layer, they are calling it as Reinke's space, where there will be edema, which will lead to Reinke's edema, okay. So we'll practice these diagrams. If you draw them, you will get some good marks, okay. So now let us move on. So Reinke's space, it is under the epithelium of the vocal cord. It is a potential space with scanty subepithelial connective tissue. So it has some connective tissue, but it is scanty, so it is a potential space, okay. It is bounded above and below by arcuate lines, okay. In front it is bounded by what? In front by anterior commissure, behind by the vocal process of arytenoid. Okay, so some more anatomy here of the Reinke's space, guys. So let us look at this. See, at least this much we can understand. Here the vocal cords are there, right? This is how the vocal cords are, two of them. This is the anterior and this is the posterior. So definitely at the back there is arytenoid cartilage, right? At the back there is arytenoid cartilage. So this part definitely we can understand. Behind by vocal process of arytenoid, okay. So what will happen? Edema of this space causes fusiform swelling of the membranous cords, Reinke's edema. So if there's edema of the space, it will cause fusiform swelling of the membranous cords. So it's a membranous cord, it forms it, so there will be swelling of this membranous cord. So fusiform means spindle shape. So let us see now, if this is anterior and this is posterior and the vocal cords are like this, right? Now we should have some kind of an edema which is fusiform. So some kind of a spindle shaped edema should be there here. Let's see that. So this is normal vocal cord. Look at the Reinke's edema. So some kind of a spindle shaped spindle. Is this a spindle? Spindle shaped fusiform. Perfect. So that is Reinke's edema. Okay. So where will you see this? Mostly in smokers, etc. So whenever there is chronic hypertrophic laryngitis, that is inflammation of the larynx, so you can see all this. Reinke's edema, you can see there. Okay. So Reinke's edema is bilateral, so it is a bilateral condition, both the sides. Diffuse meaning is what? All over, diffuse. Polyposis. So why is there? There is collection of edema fluid in the subepithelial space of Reinke. Usually the voice, where will you see it? In smokers and people who abuse their voice also. Both vocal cords show diffuse symmetrical swellings. Diffuse is like spread out over a large area. Okay. So wherein all you will see in smokers and people who abuse their voice. Bilateral condition. So basically when you come to benign tumors of larynx, you will see that this Reinke's edema is, they're telling that it is a non-neoplastic condition. Okay. So that's all you need to know. Let us say it is a non-neoplastic condition. So because of the Reinke's edema, what will happen? There will be polypoid degeneration of vocal cords. Okay guys, are you understanding? So what are we looking at today? Today we are looking at Reinke's edema of the vocal cord. So that will lead to what? Polypoid degeneration. So bilateral symmetrical swelling of the whole of the membranous part of the vocal cord. It is seen in middle-aged men and women. This is due to edema of subepithelial space. So same things, voice misuse, heavy smoking, chronic sinusitis, laryngopharyngeal reflex. Okay. So they are telling that these are the etiological factors. So they have added some more causes have been added here. Guys, focus. Misuse of voice. This we said, right? Voice abuse. Then we said smoking also we have already mentioned. These things are new for you. Chronic sinusitis, laryngopharyngeal reflex, and also mixed edema. Okay. So what will these people come in with? They'll come in with hoarseness of voice. Okay. They will use the false chords for voice production. So you have true chords and false chords, right? So they will start using the false chords for voice production. So they will only get a low-pitched, rough voice. Okay. So when you do laryngoscopy, the vocal cords will appear as fusiform swellings with pale translucent look. Yes, pale translucent look. Actually, in this photo, if you see, right, this is anterior and this is posterior, you can see that they look a little translucent, right? They look a little translucent. Then, ventricular bands may appear hyperemic and hypertrophic and may hide the view of true chords. So they may ventricular bands may appear hyperemic and hypertrophic. Okay, we are not going into the details of that. What is the treatment? We have finally reached the treatment. So basically longitudinal incision in the cord, removal of the gelatinous fluid. This is like perfect, right? Say remove the gelatinous fluid. So how? Make an incision, longitudinal incision and remove the gelatinous fluid. Okay. Then you re-educate the person in voice production and tell them don't smoke, etc. What else is there? Decortication of vocal cords, that is removal of strip of epithelium. So this is yet another thing that they have said. Okay. Then voice rest the voice, speech therapy for proper voice production. So that is about the treatment of this Reinke's edema. So let's take a quick recap. In smokers, usually you can remember this photo. Where is the Reinke's space? That first of all you should understand that. So you have understood the layers and all that. So you know that this is the Reinke's space where fluid will fill up and it will lead to Reinke's edema. So what will that lead to Reinke's edema? It will lead to polypoid degeneration. Polypoid degeneration. Remember this word, polypoid degeneration of vocal cord. Okay. And then Reinke's space you have understood. So you can see it in laryngitis. Then this is the photo, how it looks. So Reinke's edema, it is bilateral, fusiform. Look at the words that they have used. Fusiform, polyposis. It's a non-neoplastic condition. Where is that word? Fusiform. Fusiform. That was a nice word. Okay. So why does it happen? Misuse of voice, smoking, chronic sinusitis, laryngopharyngeal reflex, mixed edema, right? Then you will see that these people will have hoarseness of voice. They'll be using their false vocal cords and they'll only be getting low-pitched, rough voice. Then when you do laryngoscopy, you will see fusiform swellings, pale, translucent look. Pale, translucent look. Okay. Pale, translucent look. Give us a pale color. Pale, translucent look. Okay. Ventricular bands are hyperemic, hypertrophic. They hide the true vocal cords. Treatment, there are some different things written here. Decortication of vocal cords, removing the epithelium, strip of epithelium. Incision, removing the fluid, re-education on the voice, voice rest, etc., etc. Speech therapy. That's all in Reinke's edema, Reinke's space, smokers. That's it. Bye-bye. So guys, just why to leave this word ununderstood? Ventricular bands may appear hyperemic and hypertrophic. Where are the ventricular bands? Let's look at them. So, this is the ventricular fold. Okay. So, they are showing this as the ventricular fold. Okay. So, let us look at another terminology here. They said the person will use his false vocal cords, right? So, basically this is posterior view, guys. That guy's faces that side. So, from behind you are looking at his vocal cords. So, this is the vocal cord, right? That is what is the cross section we saw. All the diagrams. So, above this true vocal cord, there is something called as a false vocal cord. So, that guy is trying to use these. Okay. So, that he'll get a low-pitched voice. Okay. See that cross section, if you didn't understand, now you can understand it better, right? So, this diagram looks exactly like this now. See? So, basically posterior view this is. That guy's face is that side. Okay. You're looking at him from behind. Now, it makes more sense, right?